Thank you, Dr. Repka. And our final panelist is Dr. Charlotte Yeh. She is the Chief Medical Officer for AARP Services Incorporated. In her role, Dr. Yeh works with the independent carriers that make health-related products and services available to AARP members to identify programs and initiatives that will lead to enhanced care for older adults. Dr. Yeh is widely recognized for her commitment to and passion for the healthcare consumer, and she's received numerous honors for her efforts on behalf of patients. As a healthcare leader, she has served on numerous boards and committees throughout her career and currently sits on Blue Cross Blue Shield of Massachusetts Foundation Board, the Optum Labs Scientific Advisory Board, and the HX 360 Advisory Board. She will be providing observations to bring the report and its recommendations to action.
Thank you very much. I just want to say I'm truly honored and privileged to be here today, and I have to say it's a fantastic report. And I'll start by saying, this is personally meaningful for me. My father is blind in one eye since childhood from a preventable eye disease, trachoma. And how sad it is that we have people who are suffering from blindness from something that is totally 100% treatable. So what I hope to cover for you today is, it's a fabulous report. I love the recommendations and the importance of awareness and of eye health. But I'm going to suggest focusing on 3 very specific stakeholders if you truly want to have action and impact. So before I get started, I wanted to share a real story to tell you why those stakeholders are so important. So it starts with a friend of mine's mother, who was, late 80s, early 90s, legally blind from macular degeneration. Jesus, seems to be a theme today across. Living independently at home as she had for many years in an apartment, but, as she's been aging, 2 healthcare workers literally providing 24/7 with her blindness, et cetera. I get a call from my friend saying, oh my God, my mom just got admitted to the hospital. I said, what happened? Well, her home health aide said in the last few days she's been acting really paranoid, that people are coming into her house and stealing her things, and obviously that's not happening. So we took her to the emergency department, and being an emergency doc, I know we can always find something, so we found a little infection that, she had an infection, so was admitted to the hospital and being evaluated for her acute onset of paranoia. Psychologist, et cetera. And as they evaluate further, my friend calls me back and said, oh my God, my mother is just fine during the daytime, but every night she gets really confused, doesn't know where she is. You've all heard of sundowning, and delirium that occurs in hospitalized patients. And I said, well, why don't you put something really familiar? Now, I know she can't see as well. She's legally blind, but maybe a tape recorder, have voices of familiar faces, maybe a large enough photograph that maybe she can see, just to keep her oriented. Another few days later, my friend calls me back and said, oh my God, Charlotte, that was the most wonderful piece of advice. I said, what do you mean? Well, we found out what was going on. I said, what do you mean? He said, well, she's been living in this apartment for her entire life in New York City, little apartment. And my sister found out they were doing construction on the apartment next to her. So they were going to be pounding, the walls would be shaking, et cetera. So his sister thought, I better take all those pictures of our family that are over her bed and take them down, because what if they should fall on her while she's napping or something in the middle of construction? And he said, we took the pictures down, and now think about this. Here you are, a 90-year-old lady, you've lived in your apartment your whole life, you have all the pictures, you wake up in the middle of the night, you look up at the wall, where are my pictures? What do you think? Somebody's in my house stealing my things, right? He said, once we figured that out, we put the pictures back up on the wall, and you know what? She's totally fine. I said, oh my God, isn't that wonderful? Of course, 2 weeks later, he called to say she just got admitted again because they thought, because of her paranoia, she was given antipsychotic medications, and when they discharged her, they forgot to take her off the antipsychotic medicine, so she had acute episode of low blood pressure, fell, and was back in the hospital, okay? So I'm telling you this story because if you truly want to have an impact, one of the key stakeholders is you have to think about the payers, the policymakers, et cetera. Okay, WIIFM, what's in it for me? So as part of your recommendations, and I totally agree with the importance of data and surveillance, et cetera, but are you thinking about the data that says, What is the contribution of poor vision to medication errors, readmissions, hospitalization? Okay, now you can say that small investment you make in surveillance, screening, and treatment of eye vision may actually have major reductions in healthcare costs down the road. What are you saying, because eye vision and eye health is not necessarily covered, that correction of vision could actually reduce expense down the road, patient safety, errors, medication adherence, compliance? What are you doing to show that there is a difference and you can improve the medical loss ratio that insurance plans are held accountable to? So you have to think beyond just the clinical and what we do in the practice of medicine, but start thinking about, if you were a payer, how would you convince them to say, this is worth covering? And then think about the U.S. Preventive Health Task Force. We know that health insurance plans are going to follow whatever the U.S. Preventive Health Task Force recommends. And it's always in the terms of cost, identification, et cetera, that if that prevention makes a difference. But have we actually talked about that prevention, not in terms of only healthcare costs, but in terms of quality of life and that consumer need, which brings me to the second stakeholder, which is the consumer. It is not just about telling the consumer, here's what you need to do, and here's your 5. First of all, I would say take your 600 pages, can you simplify it into the 3 to 5 things that every person should do? Keep it simple. What you really want to say is, how you see is how you live. And if you can get that message through, the rest of the action will follow. And think about what matters to the consumer. So when you're creating that message, we know from AARP research, and by the way, I'm AARP, not the American Association of Retired Persons, because over half our people are actually not retired. It's really about vibrancy and vitality as we age 50 and older. We're living and working longer than ever. So the 3 things that I know from AARP research, that if you want it to resonate, is first of all, what does eye health? One of the things we know our consumers really fear is being a burden on others, being a burden on family and friends. So if earlier screening, earlier intervention allows you to stay more independent longer, not be a burden on others, that's a message that could resonate. And the second big thing that we know is cognitive health. We know that over 90% of our members are 50 and older across all ethnic disparities. Actually, for African American is even more so, is fear of brain health or cognitive decline. So what is it about eye health that can help you mitigate against onset of dementia, depression, poor brain health? That would matter. And the third area, which I've already alluded to, over 90% of people 50 and older, when they think about aging, they want to live in their own home. So what is it about maintaining your eye health that allows you that independence? And then finally, the third stakeholder, so I'm a little running out of time here, that isn't mentioned anywhere in the report, and yet I think is critically important, is what is in it for the marketplace? There is no way that public funders, and all we've been hearing about today is money, of course, budget, worries, but there is no way, even if we had all the money in the world, that we would be able to support through public funding eye health and eye importance. So are you thinking about how you can suggest to the disruptors in innovation, to the marketplace, to say, gee, you could create simple tools that actually could allow consumers to live at home, live well, in a place that they can afford? I just want you to know the 50 and older contribute about $7.6 trillion to the economy every year. That's third behind US and China. Over 50% of the dollar is actually controlled in some way, shape, or form by somebody who's 50 and older. So people are willing, and you know how much we spend on complementary medicine. So think about the opportunities that consumers would be willing to spend out of their own pocket because it maintains their independence, improves their health. Where's the technology to allow you to do that vision screening in home? Can you do it through telehealth in any way? Can you do it over the phone? Think about those methodologies that you can reach out through social media, through website and others, that would bring in the innovators who would create the kind of products to allow people to stay at home independently and actually join the voice for early screening, early detection, and early intervention. So with that, I just want, and think about your home environment. What are you doing in working with the Home Builders Association, the architects, to talk about proper lighting, to talk about the colors, to talk about layouts, to talk about ease of flow as you age and want to stay in your own home? These are your opportunities to make this whole concept of eye health be something that becomes a public agenda and not simply about following the clinical evidence guidelines, as important as they are. So with that, I just hope that you can remember, how you see is how you live, and the opportunities you have to change the landscape among the payers, the policymakers, among the consumers, families, and caregivers, and among the marketplace. Thank you.
Thank you.